And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, Interim Director at WEIU. My co-host is Dan Jones.
Happy Monday, everyone.
Good coming in. And our guest today, making a repeat appearance, Mr. Dr. Eric Davidson. He's the EIU Interim Director at Health and Counseling Services here on the campus. Welcome back, Eric.
Hi there.
We know we have you back a lot, but I think it's important. I know people are a little bit, I think, COVID, whatever you get, COVID fatigue, I think the word is. But why don't we just assess where we are right now overall, then we'll get into some details.
Yeah, sure. We're in middle of two periods, and I would say one period would be the ongoing mitigation and the ongoing testing and trying to identify where COVID is in the community and on campus. And I think the second period that we've entered in is really looking to the future and attempting to begin vaccination of our community and our campus. So, there's an overlap of these two periods that greatly have preoccupied our time, the county health department's time, and frankly, a lot of people's time.
Since we're on campus, let's start with the campus. What are the campus numbers, and how would you assess the campus right now at EIU?
Like what we're seeing in the community, numbers seem to be down compared to where we were last fall, but we are still having positive cases. We are still having students, staff, and faculty that are being quarantined, so the threat is still there. It is still present. It is still existent, and it's really not a time to kind of say, we're seeing the light at the end of the tunnel. We can start relaxing and doing that. With vaccinations, there are groups of individuals on campus that have started being vaccinated, such as our medical staff in the medical clinic, our first responders and university police, and a lot of other individuals on campus that are directly involved in the day-to-day care and treatment of those individuals that are positive or in quarantine.
Yes, we ended last semester fully remote, and we began this semester hybrid. What led to the decision of us ending remote and starting back hybrid?
Well, I think really when you look at how we began in the fall, was the decision to move ahead and begin in the spring. So my understanding is about a third of our classes are completely in person, a third of classes are completely remote, and then we have a third that are actually hybrid. But I think that the main factor is around Thanksgiving, we were seeing rates go up. The governor issued some warnings, and I think by time we got to December, there was a little bit of good news in terms of how many we were seeing positive, how many we were seeing in quarantine, and the decision was to go back to how we were at the beginning of the fall for the spring semester.
We've switched from the IDPH to the SHIELD testing. Talk about that transition and what that means for people who really don't understand.
The IDPH testing really provided us an opportunity to have a filler as the SHIELD Illinois project was coming up. If many people remember, the University of Illinois thought that they would have the emergency use authorization for the test. They actually thought they had it. They didn't have it. And it really took them the better part of the fall semester. And even now, they still don't have the full emergency authorization use. So the DPH really provided coverage for us. We were able to offer that testing every other week. And then we really did that in partnership with the Illinois Department of Public Health, which is part of the reason we were able to open it up to the community. So, we're very thankful that we had that opportunity to do so. We had thought that we would be continuing with that in the new semester, so we did have one IDPH test. We thought we would have a second one, and then the SHIELD Illinois folks came and said, although they didn't have the emergency use authorization, there was another process that they were able to go through that focuses on laboratories, and there was a laboratory indicator that had navigated the labyrinth of regulations, and they were able to go ahead and start testing. So we actually started testing using SHIELD 2 weeks earlier than what we originally thought we would have compared to where we were a month ago.
And not to be gross, but that's the people refer to as the spit test.
That is the saliva-based test.
Saliva.
And, it's, I I do it every week, and we have a big joke among my staff that now they've got me timed doing it, and every week that I do it, I try to beat my previous week's time. So I'm down to about 90 seconds to generate the amount, but some people have a little bit more difficult time, and it will take them 5 to 10 minutes. So we're trying to always assess the situation, and we're thinking about putting pictures of lemons and other stuff on the walls to try to help people generate that saliva.
Can you tell us what the general response on campus has been to the shield testing?
Yeah, I think it's positive. We're seeing numbers increase every week. Initially, the test was really intended to be a surveillance test. It wasn't intended to be a test for everybody. And the thought was very similar to our research project. We would sit and we would randomly select 500 people that we would invite to come and test. Hopefully a good number of those individuals would come and test. And from those results, we would be able to see what was going on in that sample. And then we would be able to generalize those results to the general campus population. So the thought originally was, if things were staying the same, we really anticipated that within the general campus community, our rates were being flat. If we saw rises in the sample, we would generalize. We were probably having rises in the general campus community, and the same thing with the decreases. But several things have changed since we started planning that. One of the biggest events is that Governor Pritzker has allocated $20 million to promote the use of the shield test on colleges and universities across the state. So we're benefiting from that as well, and that is probably going to allow us to expand some of the shield testing that we're doing.
Is there another one set up, scheduled? Talk about what's next, and then eventually will there be just walk-ins available?
Yeah, it's hard to say, and that's a possibility. But right now, what we're planning to do is currently we will test using the shield 3 days a week. I think no matter what ends up happening with other ways of testing, we will probably continue to do the random selection and invite people just to try to get people to come and test. But we're really looking at least 3 days a week. Right now, we're typically testing from 9 to noon, Monday, Tuesday, Wednesday. We are having some conversations about possibly moving that to Tuesday, Wednesday, Thursday. So this is always in motion, as anything with COVID is. And again, we're always assessing and trying to figure out what to do better. And every week is a learning opportunity for us.
Any idea of how long shield testing will remain on campus?
I would suspect that we will continue to test throughout the remainder of the spring semester. I don't see that going away at all during the spring. I would imagine, depending upon what we're seeing with the pandemic and cases across the state as well as on campus, I suspect that there could be a possibility that we would continue in the summer. That's a little bit hard to say. But I would definitely say for the rest of the semester, we're committed to testing in one fashion or another.
Like you said, we knock on wood when we talk about light at the end of the tunnel, and things have changed a little bit for the better. There's still people that are sick, and there's people, unfortunately, that are dying. But what do you think the main reason is we've seen a change in the last 30 to 45 days?
That's a good question, and one that I really haven't thought about in depth. I think we're past the holidays. So I think people aren't engaging in all the social activity that they would. I mean, everybody wants to go to grandma's for holiday dinner. Even if they're typically sick, they still go to grandma's for holiday dinner, and people feel safe and secure around family members that they typically, lower their guard and maybe lowering their mask and those types of things. So I think part of it is we are beyond that, and I think people are getting back to the regular, okay, I have to mask, I have to socially separate, I have to wash my hands, those types of things. So I think that contributes a lot of it. I think the fact that it's been cold, the weather has not been that great, people are inside, they're not out and about socializing. I think those things have helped us get to where we are today.
Obviously, there's a big social event this weekend, the Super Bowl. People are talking about, that people stay home, not go to parties, not go to bars, not have people over. I mean, how do you tell people, not to do something like that?
I would say don't do it. Just don't do it. We're still in the throes of the pandemic. And everything that we've talked about in terms of protective behaviors and strategies still holds true and will still hold true despite a large number of people getting vaccinated. For this weekend, I would say it's probably in everyone's best interest to continue wearing masking if you are going to be in a group setting. If you're in a group setting, maintain the social distancing, but if at all possible, just avoid the group settings.
Stay home and enjoy your family
Exactly.
and watch the game.
Exactly.
And hope Tom Brady loses. Oh, sorry. I should have.
Yeah.
What about class issues? Has there been any class issues so far?
No. We've been very happy. So when we look at our epidemiology and we look at our positivity rates and all those types of things, classroom spread does not seem to be an issue for us. Likewise, on-campus residence hall spread is not an issue for us. Those really are protective environments for our students. As we saw last semester, we're seeing spread in social activities, those social activities which frequently occur off campus, as well as some referent groups. But for the most part, classes and the residence halls really seem to be safe environments and protective environments for our students.
We talked a little bit about COVID cases kind of going down these last couple of days. Was there any worry that there would be a spike because it is cold? And usually around this time of year, people get sick?
Yeah. In terms of COVID spread, my biggest worry was when we came back to school from the holidays. We're past that now. So, I do fear the Super Bowl and what we may see in the next 2 weeks as a result of the Super Bowl. What was the second part of your question again?
Did you believe that there was going to be a spike because it is cold? And
I don't think it's necessarily because of the cold or the temperature. This time of year is always a concern for us for influenza. But when you look at what we're seeing locally and throughout the state and nationally, influenza seems to be fairly constant and lowered compared to what we're normally having. There is some discussion as to whether or not that can be attributed to the fact that everybody's wearing a mask and maintaining social distance, or is it just a low flu year? Because occasionally we will have low flu years. And, I think we're going to have to see how that plays out in the coming weeks. One of the things that I say to my wife is, we're doing so well with mitigating COVID. My worry is that as we move along and more people get vaccinated and they begin to loosen their guard, we're going to actually see a big uptick or a big spike of flu later in the season compared to when we typically are seeing it now.
I think the other thing, people are so much more cleanly now. They are washing their hands and sanitizing. So that also may help. I had a doctor's appointment last week for a checkup, and that's one of the things that my doctor said. He goes, "Yeah, I don't see the flu at all this winter." He goes, "I'm excited about that," but he was also said, "But you never know. After, if we get some good news, is that going to
exactly? We're creating a lot of great healthy habits that are helping with not only COVID but a lot of other illnesses.
Yeah. If we maintain them, will be the key.
Exactly.
Right? I know that you might not be the person to ask, but I ask anyway, since we're talking a little bit about sports. The other thing that's happening, obviously basketball is being played on campus with no fans, but EIU football starts on Sundays in just a few, 4 or 5 weeks from now. I'm terrible at dates. I think February 22nd. Have you talked to anybody, or is there a game plan for in fans or no fans?
That I don't know. I do talk with the head athletic trainer, Jim Nave, a lot about what they're doing to mitigate among their players, but I can't tell you exactly what's going on.
I know people are starting to ask if they can go since it's an outside sport and you could spread out a little bit. So I don't know if Eastern's made that decision. So that's all right. The other thing I noticed a lot about, and the reason I bring this up is I went to the doctor and they asked me, have I traveled out of state? And, I haven't traveled out of state. But how do we really track the out of state and how that really factors into the health and COVID and all that?
Yeah, a large part of it goes with the contact tracing. So hopefully when those individuals that are positive in our cases, when they are contacted by the contact tracers, they're being honest, they're being forthright and saying, this is where I've been, this is who I've been with. And then as those reports are turned into the state, the state is able to look at their database and kind of track where people have been and those connections. And, that's something that the state epidemiologists probably are looking at quite frequently to figure that out.
Okay.
One of the biggest conversations surrounding COVID right now is the vaccine. How do you believe the vaccine will change kind of the protocols we already have going on? Will it make it better or will it make it more intense?
I don't know if it'll make it more intense. It may cause the protocols and the practices that we're engaging in to last longer than what a lot of people think. When I talk to some people, they think that once, the vaccine is kind of the magic wand
it's a super shield,
everybody gets vaccinated and everything will go away. But there's still a lot that we don't know about the vaccine. For example, we don't know if the vaccine is a sterilization vaccine. And what that means is it may prevent you from getting the virus and having the symptoms of the virus. But we don't necessarily know if the vaccine will prevent you from giving the virus to someone else. A sterilization virus does that. So that's one of the things that, we're going to have to figure out and learn. There's a lot of talk about the different variants of the virus that are out there and about now. And it seems like most of the vaccines will address those variants, but the virus is always changing. So it's hard for me to look in the crystal ball and say when this will be over and when life may turn back to some semblance of normality. But I think that we're going to be in this for a much longer haul than what a lot of people would like to think.
We're talking to Dr. Eric Davidson here on the EIU, Director of Health and Counseling Services, on issues and attitudes. Speaking of vaccination, what Daniel just talked about a little bit, I know that everything's about getting the supply, but is there a vaccination plan for students, faculty, and from the university? And can you update us on that?
It is in development. So currently, in order for the university to be able to administer the vaccine, one of the first steps that we have to go through is we have to be registered with the state vaccination registry. So we've submitted the paperwork to the state for that and are in the process of having that reviewed.
I broke my own rule. I apologize. I left my phone
Not
out.
a problem. So once we have that first step taken care of, then it's a matter of identifying the folks on campus that will have access to that registry, getting trained for that registry. And then when that process will begin, there's actually a formal agreement that the university will have to sign with the state, basically acknowledging things like when we administer the vaccine, we'll update the registry with the records and those kind of things. My hopes are that, by mid-March, we will have all those things taken care of. My understanding is that it's usually a 4 to 7 week process to get through that approval process. So I'm hoping mid-March we'll be able to have the capability of doing it, and then it's just a matter of the state giving us the vaccines.
That's the biggest issue, right?
That's part of the biggest issue, and I think some people have been kind of amazed at getting through phase 1A, and now we're in phase 1B. But I think as we continue moving along the phases, I think the phases are going to be longer to get through. So I, as a realist, I guess maybe a healthy skepticism is I'm hoping that maybe come April we'll be able to start vaccinating students, and of course if we can do that before then, that'll be great. But I'm thinking it's going to be toward the end of the semester when we have that ability.
let's just say that everything works out. You get the vaccines, and by whatever, March 28th, we can start vaccinating. How long would it take to vaccinate this campus in terms of students and faculty?
That's
a tough question for you.
That is a tough question, and it's one that I've thought about, because part of it will depend upon how many folks have already been vaccinated. I mean, we have a small number of first responders and medical staff who are already being vaccinated. As we move along, I figure that we'll have, a good portion of our community who are over 65 be vaccinated, and then down the road, those that may have some medical health issues. So it's really hard to gauge that, because we really don't know what those numbers are going to be like. We're talking in the medical clinic, is it something that we're just going to have open for an entire week, and we're going to be focusing on immunizations? Is it going to be something that we're going to do in a 48-hour period and kind of do through the night? I figured it'll be more like a regular primary care clinic that we'll have somewhere on campus in a centralized location, very, very kind of similar to what we're doing with the testing right now, or what we've done with the IDPH testing.
But you're still going to have to vaccinate between probably, 5,000 people maybe?
Probably pretty easily, if we're looking at our on-campus population and faculty and staff.
Yeah. Good luck with that.
Yeah.
Don't ask us for the math.
It's going to be a Herculean feat to do, and there are going to be a lot of people working hard to make it happen.
But I think when it gets to that point, I think even your staff and most of WEIU will be excited that because that's kind of one of those, just. I don't know what the word is, but just it's like that light that says, I've got this far now.
Yeah, exactly.
Like a cowboy point, so there you go. Right now, we've been talking a lot about the vaccinations and health, but there also is the other side, counseling. Have you seen an uptick in students and faculty needing counseling, and what are some signs that we need to be looking for?
Yeah. We've been able to add to staff, so we're doing a much better job of meeting the demand. But almost any student who comes in, my counselors are basically saying their issues are being exacerbated by what they're experiencing with the pandemic. A lot of students, because of our social distancing, are experiencing greater bouts of loneliness, difficulty socializing and mixing and interacting with others. So it is definitely adding to the stressors that our students are experiencing.
Something you said earlier that kind of stuck with me was that the virus is always changing. How do you prepare for various maybe new strands popping up?
I imagine if we think of how the vaccine companies look toward flu. Typically, you'll hear flu vaccine being a trivalent or a quadvalent vaccine, and tri is meaning that they're focusing on 3 strains, and quad would be 4 strains. I would imagine if it ends up being a vaccine that has to be given on an annual basis, like the flu vaccine, that will be the approach that they'll take. And part of it is going to be guesswork. So just as the flu vaccine that we have for this season was beginning to be prepared this time a year ago, that may be a route. I'm not a vaccine expert by any ways, but that's just kind of my speculation. And I think the other thing is that many of the practices that we've engaged in, the hand washing, social distancing, I think for us to successfully navigate COVID and other illnesses in the future, we're just going to have to embrace that and make that a part of our life.
I know a couple of people, including you, have asked a little bit about commencement. I mean, what you do when the decision date, whether the commencement will be made?
I do not know that.
So, 'cause that's another thing that's going to be on campus. High school and junior high sports started this past week in Illinois, which brings the kids together. The parents can't go to the games, or maybe they can go to the home games. It's kind of confusing on what city does what. But that's also going to bring more people out and about. So does that concern you at all?
It does. My son is actually on the 7th grade team, and we had two games Friday and Saturday, and the Charleston district is working hard. I've been very impressed with what they've instilled, at least in my son's team and the 8th grade team. The boys are wearing masks, they're social distancing, even when they're on the floor playing. The good majority of boys are having their mask on, and if it's slipping down, they're putting it up. Charleston, at least for the middle school, are letting each boy have 2 individuals come and watch the game, but the opposing team are not allowed to bring family members. And one of the nice things for us as a family is that the Charleston Middle School has a camera that they're able to basically broadcast the game during the time over YouTube. So I think the Charleston district is aware of the challenges, and I think they're really striving to do their best to do the right thing.
Okay. Couple minutes left there, Davidson. You got anything else?
Yeah. Are there any plans being made as far as heading into fall semester?
There's always discussions, and I really I hear whispers and words of things that may be going on, but at this point in time, I've not really heard anything definitive. I think the desire is to try to be back to normal as much as possible, to try to have as many in-person classes as much as possible. I know from the student affairs side of the fence, we want to be able to offer activities and events that engage our students and allow them to be physically present and interacting with one another. So I think there are some strong desires to be as normal as possible and to give our students the college experience that they're expecting.
Anything that we didn't ask you that you want to get the information out today, Eric?
I would just sit there and say to our campus community, if you get selected to be randomly chosen to test, to please do so. It is important to have you part of that sample so we can generalize what we're seeing to the larger campus.
Okay. Well, we're just going to ask you some random dumb questions now.
Hey, all right.
Have a little fun. All right. So, did you make a New Year's resolution? Are you willing to share it?
Yeah, I did. I made 2. One was to work out every day, and of course, I've not done anything near that. The other is to read every day, and so far, I've started my 8th book yesterday.
Really?
Wow.
Yeah, that's pretty good. That's more than I've read the last decade. Would you parachute?
I would.
All right. So
I would.
how many states have you lived in?
I've only lived in one state.
Illinois? Oh, you're in Illinois? Okay.
I'm actually a local boy. I grew up in Neoga, so I moved to Charleston, and the big city lights captivated me and broke my mother's heart that I never returned back to Neoga. So
I did not know that till today. Your Super Bowl pick is?
I'll be honest, I'm not into sports, and I really don't even know who's playing.
Chiefs or Buccaneers have got to win that Super Bowl?
Chiefs.
Good, because if you'd have said the Buccaneers would have been your last
I would have said the weekend, but
Your favorite hot dog topping, Mr. Davidson?
Dill relish.
Ooh, that's a good one. I like that. All right, favorite I'm going since you're a doctor. Favorite medical related show? Is there a show that you've loved in the past that you don't miss? Is there?
Oh, that's a good one. I'd have to say ER.
That's it.
ER.
All right. And that's a question I thought of today because I was thinking about Old Main. Have you ever been up at the top of Old Main? You got to look out.
Believe it or not, after having been here for 30 years, the answer is no.
Really? I thought maybe with you.
And I've never been in the steam tunnels either.
Okay, there you go. So those are an interesting question. Contact information if a student wants to talk to you or talk to your office.
Sure. The easiest thing to do would be call the medical clinic at 581-3013, especially if they have questions about COVID testing on campus, whether it be through the medical clinic or through SHIELD. And the staff will talk to them and give them the best advice or guidance.
Thanks for coming in.
You bet. Thank you.
WEIU.